Good morning, student. Today's topic of discussion is the trochlear nerve. You all know the trochlear nerve. It is the fourth cranial nerve, and it is the most slender of the cranial nerve, and it is the only cranial nerve which exits from the dorsal aspect of the brainstem. Then come to the functional component. It has two functional components, somatic efferent and the general somatic efferent. The somatic efferent, it is concerned with the movement of the eyeball through superior oblique muscle, and general somatic efferent, it carries the proprioceptive impulses from superior oblique which are relayed in the mesencephalic nucleus of the fifth nerve. Not only it is slender, it is the longest cranial nerve also. Here come to the position of this trochlear nerve. In the previous class, you know, this is the oculomotor nerve which comes out from the medial side of this, and it is the trochlear nerve. This is the trochlear nerve. Okay. In this picture, this is the trochlear nerve. This part is the trochlear nerve. It comes out through this dorsal aspect and come to the ventral side. Okay. This one is the trochlear nerve. It comes out to dorsal aspect of the brainstem, then it turns around it and then goes to the orbit. Then come to the deep origin of this trochlear nerve. It arises from the nucleus situated in the floor of the aqueduct of the midbrain at the level of the inferior colliculus. It lies dorsal to the medial longitudinal bundle. This nucleus lies in a line with the nuclei of the oculomotor, abduction and the anterior horn cell of the spinal cord. So previously, this is the adenoidal nucleus and the oculomotor nucleus. These are the one nucleus, and this is the trochlear nucleus. It is lies in line with this oculomotor nucleus and also with this abduction nucleus. This line, it forms this line. Okay, these things forms one line. So this nucleus lies in the line of the nuclei of the oculomotor, abduction and the anterior horn cell of the spinal cord. Then come to the course. It has four parts. One is the fascicular and the precavernous, intracavernous and the intraorbital part. Then come to the fascicular part. From the nucleus, at first the action leaves and the nerve first runs downward and laterally through the tegmentum of the midbrain, then turns backward round the central gray matter to reach the superior medullary velum, where the nerve of the two sides cross each other. So the nerve, this is the trochlear nerve, which cross near the superior medullary venom and goes to the opposite side. Okay, it decussate in the anterior medullary velum or the superior medullary venom. Then come to the precavernous part of this nerve. This precavernous part, it leaves the brainstem on the dorsal surface just caudal to the inferior colliculus, and it winds around the brainstem, run forward beneath the free edge of the tentorium, pierce the dura on the posterior corner of the roof of the cavernous sinus to enter into it. Okay. It between the posterior cerebral and the superior cerebral artery. In this precavernous part, it passes between the posterior cerebral and the superior cerebral artery. It enters the cavernous sinus by piercing the dura mater at the crossing point of the free and attached border of the tentorium cerebelli, a little behind the posterior clinoid process. In the previous class, you find this picture. in this cavernous sinus, this is the oculomotor nerve, and this is the trochlear nerve. It lies on this lateral wall and just below the oculomotor nerve, and above of this ophthalmic and this maxillary and this abduction nerve. Okay, so this is the pre-cavernous part. Then the nerve, it enters into the cavernous sinus. Then come to the intracavernous part. In the intracavernous part, it runs forward in the lateral wall of the sinus, lying below the third nerve and above the first division of the fifth nerve. In the anterior part of the sinus, it rises, crosses over the third nerve, it passes through the superior orbital fissure above and lateral to the annulus of Jean. It goes to the superior orbital sinus and passes above and lateral to the annulus of Jean. So it enters the orbital cavity. This is the picture. This is the trochlear nerve. It lies above and lateral to this annulus of Jean. From the annulus of Jean, all of this muscular origin from this takes place from this annulus of Jean. So this is the trochlear nerve. After entering, it goes behind this muscle. This is the superior rectus muscle, and this is the superior oblique. So it passes behind this superior rectus and ultimately supply to this superior oblique muscle. So this is the intracavernous part. Then come to this intraorbital part. It enters the orbit through the lateral part of the annulus SOF, superior oblique fasciculus, and the frontal and lacrimal nerves laterally, ophthalmic vein inferiorly. Divide it to fan-shaped manner into 3 to 4 branches. Ends by supplying superior oblique on its orbital surface near lateral border. So then it come to this region. It divide into 3 to 4 branches and supply this lateral border also. Here, this is the trochlear nerve. This is the trochlear nerve. It enters the orbit and ultimately supply this muscle. This is the superior. This is the superior oblique muscle. Okay. Now, at first, it lies in between this ophthalmic nerve and this ophthalmic artery. Then it proceeds forward and ultimately goes medial to this ophthalmic artery and supply this inner surface or the ocular surface of this muscle. Then come to the connections of this nerve. It has some cerebral cortex connection, motor cortex through the corticonuclear tract, and the facial cortex, superior colliculus, and the tectovalvular tract and the frontal eye field. It also connected with the nuclei of the 3rd, 6th, and the 8th nerve. Okay. And superior colliculi descending pre-dorsal bundle, vertical horizontal gaze center, and cerebellum vestibular nuclei. And it has some connection with the oculomotor nerve in the cavernous sinus, and the superior orbital fissure. It also connected with the lacrimal nerve. Then come to this applied portion of this nerve. Etiology for the 4th cranial nerve palsy. Location: the midbrain, nuclei, and the fascicular part may be affected if there is some vascular malformation, hemorrhage, demyelination, ischemia, or infarction of this area. Then the nuclear and the fascicular part of this nerve may be affected. There may be subarachnoid space if the aneurysm or infection, mastoiditis, meningitis, post-lumbar puncture of spinal anesthesia, trauma, neoplasm, etc. It may causes the subarachnoid spaces infection or increase tension of this area, so there may be a chance of fourth cranial nerve palsy. And in the cavernous synapse, due to neoplasm like meningioma, infection like syphilis, tuberculosis, herpes zoster, inflammation like sarcoidosis, it also causes compression of the nerve. And the orbital lesion, it may be due to the inflammatory infections or the neoplasm. If the nerve is cut or compressed due to some factors, the superior oblique is paralyzed and the patient is unable to turn his eye downward and laterally. So, if the nerve is cut or nerve is compressed, mainly the superior oblique muscle is paralyzed and the patient is unable to turn his eye downward and laterally. So, when the patient tries to do so, the affected side will be rotated medially, causing the diplopia. And here the look like the trochlear nerve palsy, congenital right trochlear nerve palsy, which compensatory left head tilt. Okay, so this is all for this trochlear nerve. Next class there will be abduction nerve. Okay, thank you very much.